The death toll from the coronavirus reached a tragic milestone in the U.S. on Tuesday, surpassing 200,000. After the figure was confirmed, a moment of silence was held in Congress. The United States has suffered the largest loss of life due to coronavirus, followed by Brazil. The number of confirmed cases in the U.S. now stands at more than 7 million. The pandemic has taken a disproportionate toll on ethnic minorities in the U.S. Official data shows that Hispanics and African Americans are almost 5 times as likely to be hospitalized due to COVID. And while Black people make up just 12% of the population, they account for 21% of coronavirus deaths in America. We're now going to bring in live Martin Kulldorff, professor of medicine at Harvard Medical School in the U.S. for more on this. Now, as we mentioned, the U.S. death toll has surpassed 200,000, and there's been 5,000 more deaths since yesterday. Do you think the government has lost control of the situation?
No, I think the government is trying to control the situation. The way the U.S. system works is that it's the states that have the responsibility for what countermeasures to do. So in a sense, it's 50 states, and I think some states have done well and others have done less well.
Reports have shown that the death toll among African Americans has been disproportionately high. How would you explain that?
With COVID, there is a huge difference in risk by age. So older people have more than 1,000-fold risk of mortality, of death from COVID compared to young people. So everybody can get infected, but it's the older people who are at very high risk. So for older people, COVID is much more dangerous than the annual influenza, but from children, it's much less. So the best strategy to deal with COVID is then to do as much as we can to protect the high-risk elderly people, while younger people should be able to live their lives more normally. That will, in the long term, minimize the number of mortality, the number of deaths from COVID.
President Trump has defended his handling of the pandemic, saying if it wasn't for him, you could have 2 million, 2.5, or even 3 million dead at this point. How would you rate his performance since the start of the pandemic, given the fact that, yes, as you did mention, it is a state-by-state basis, but there can be nationwide measures, and there's also been many accusations of him downplaying the pandemic?
Well, the role of the federal government is to provide advice from the Centers for Disease Control, and, for example, to provide financial resources. And to my knowledge, CDC, the Center for Disease Control, has, for example, never proposed that schools should be closed. So that has been local decisions, and I think it's very important now in the United States that the schools are open for in-person teaching. That's very important for the children, and we know that children are at very low risk because and much less from the annual influenza. So, for example, in Sweden, the schools never closed during the pandemic, from ages 1 childcare to age 15, and from 1.8 million children, there was not a single death in COVID-19 in Sweden, despite them going to school throughout the pandemic. So we know that the children are very low risk. And we know that teachers are at no higher risk than other professions. So it's very important for education and for the physical and mental health of children that they can go back to school for in-person teaching. So I think that should be a priority right now.
If we continue looking at Europe, we've seen lockdowns lifted and now restrictions being put back in place in a number of countries. Do you think that those governments acted too soon?
I think the problem is that many governments in Europe has gone for lockdowns that are throughout ages, so the same for all ages, and we have to use the fact that this COVID is very, very dangerous for the elderly, but not for the young. So we have to use that fact to let the young live more normal life until we reach herd immunity, and then the elderly can also be safe. So the key thing is not whether you should have more lockdown or less lockdown in general. The key thing is that for the elderly, we have to protect them much better. with various measures. And for the younger people, we should let them live their lives more normally. That's
Professor
the key,
of Medicine at Harvard Medical School, Martin Kulldorff, thank you for joining us on the program today.
Thank you so much.